So I chose to bring Solea into my practice because my practice is limited to children and special needs, and I just saw the benefit that it could provide. I see lots of special needs patients. Solea has definitely made an impact on that patient population. So I see them from birth all the way up to death. And so I've done infant frenectomies where nobody else in our area will do that. I've been able to reduce the amount of sedation that I do in the office because we do all types of sedation. So I do nitrous oxide, I do oral conscious sedation, and we do deeper sedation. So prior to Solea, a patient who may have been deep sedation may now be oral sedation. A patient who may have been oral sedation may be nitrous. And then a patient who was nitrous, a lot of times we're able to do now without even using nitrous. When they hear that there's not going to be any pinches involved in what we're doing, they love it. So in return, the parents love it. Because I added Solea to my practice, I have been able to add more procedures. Before I would do a few labial frenectomies, but I had never done tongue ties, and now I'm doing tongue ties. I get referrals for infants, which I had never done before. I'm doing a lot more of soft tissue surgery, so I do more gingivectomies, operculectomies. I'm removing fibromas and papillomas with the laser now. Solea has definitely increased my both productivity and efficiency in the office. There were several times where we had to send patients home. So we would attempt to anesthetize, they would not let us, and we were sending them home. Now, because we're not doing that, we're able to use Solea and do the procedures that day. I think in the special needs community, Solea is actually a safer option than our traditional handpieces. With a traditional handpiece, once you take your foot off of the rheostat, the burr keeps spinning. So there's a chance that the patient could get injured, I can get injured, my staff could get injured. With Solea, as soon as I take my foot off of the pedal, it stops. So there's no more fear of damaging tissue. And even then, if I do hit the soft tissue, it's not going to cause any real damage like a burr could. I also think it's important because it just gives such a better option to the parents. It's less sensitivity for the patients. Most of my special needs patients would never tolerate getting local anesthesia. And it just gives them another option. I have a 24-year-old patient with autism who came to the practice after he had literally run out of 4 other practices. So at that point, the doctor didn't know what to do with him. He had sent him to me for sedation. And after talking about it, I discussed what his fear was, and his fear was the needle. So he allowed me to do full quadrant dentistry on him over the course of about 3 different visits with nitrous oxide. And it gave him that empowerment. So now when he came in the last time, he needed one more restoration. And he goes, "Are you using Solea? Are you using that?" He's like, "We're going to use that with the nose, right?" And I'm like, yes, that's what we're going to do.